And I was in another practice where I was seeing most of the spine, almost all the spine, because the other guys were sports medicine and joint replacement. And so I could handle most of it because I'd done a ton of spine in my residency. I did like 2 years of scoliosis. So when it was something that really needed pain management or surgery that I didn't do, because I was doing general orthopedics, I would call up Dr. Burrow or Dr. Norton and say, hey, I got a patient for you. And when that practice closed, because those guys decided to retire, I called them up and said, hey, you two guys are getting pretty busy. Could you use some help? They said, come on right over. And then obviously the practice has changed from me joining 2 guys to us now like 11 guys. And so I've drifted into general orthopedics because basically everyone's doing spine and pain management. And so if a patient's there, and usually someone has neck pain, back pain, low back, they usually have shoulder pain, elbow pain, hand pain, knee pain. So since I'm doing that and the other guys really don't do that, and they haven't specialized in it, and since they are much more capable handling spine problems and chronic spinal pain, they refer it to me and keeps it in the practice, and it's easy for the patient, one-stop shop. And that's worked out really well. So they've gotten me very busy. I was in solo practice for 27 years, all by myself, no cross coverage, no partner. And I was like that because I'm a very principled guy. I'm a little OCD. I care about my patients. And I never found a good match for people I really wanted to be with and work with, and I was comfortable for them to see my patient. So if I wouldn't go to that doctor myself, I surely wouldn't send my patient to them. FSA, starting off with Dr. Norton and Dr. Burrow, they're just really wonderful guys. They're very well trained. They're very conservative. They don't look for stuff to do. They're more than busy enough. And they treat the patient like the patient's like their own friends, their own family. So there's a whole level above just this is a job. It's more of a calling, like a priest or a rabbi or a minister. It's more like you really care, they really care about their patients and doing the right thing and helping the patient make a decision that's best for them. Because you can have 2 patients, same age with the same problem, and one patient needs surgery and one doesn't need surgery, depending on how that problem affects their life. So it's not just, the C4-5 stenosis on the right, it's not just the arthritis in the knee, it's the patient with that. How does it affect their life? What's their limits? Do they have any limits? And I think they're really in tune to that. It's really amazing that everyone that's joined the practice since is a similar type of personality. And I think that a lot of the doctors today, the younger doctors, the very well-trained ones, seem to have a camaraderie. They work together. This is a team. Everyone in the office works together, the doctors work together, and the staff works together. We're like one family. It's a very diverse office, and I don't see what I see on television. I see a bunch of people that just really respect each other, like each other, and their aim is really, what can we do to make this person's life better? What can we do to help them take back their life? And that's what we do, and that's why I love the practice. FSA is a group that is going to help you, educate you, and help you make a decision of what will be best for your problem. And we do the entire spectrum. So for someone that just needs some counseling, okay, like whatever you're doing in your exercise program is making you worse. So you just need like a week or so of therapy to have the therapist who's got a master's or a doctorate in college to kind of troubleshoot what you're doing and change it. So I had a doctor that came to me, smart guy, maybe smarter than I am, he's a cardiologist, and he had back pain. And I couldn't find much wrong with him. I said, well, you need to do some exercise. He said, I'm doing exercises. I said, well, show me what you're doing. I just sat there, and he did the exercise. I said, where did you get those from? So I got them on the internet. I said, well, that's why you have back pain. Those exercises, I don't know where you read them, but those are bad exercises. And bottom line is, anything you do that makes you feel worse is bad for you. Even if someone else does it and they think it's great, like if someone loves pecan pie, but you're allergic to nuts, then maybe you don't want the pecan pie. So We start the very simplest thing, and it's in my little card that we have in the office. I troubleshoot a lot of problems. People have been to lots of different doctors. They don't even know what's wrong with them. They had an MRI, no one even showed them the pictures. And one thing we do at FSA is we educate the patient, we troubleshoot, we step back. If someone's had some procedures before, what went wrong? Was it the right procedure or did it not come out good? And then we help them decide what you can do at the lowest level of behavior modification, activity, changing your activities, daily living, daily exercises. Well, going to the gym and using some heavy machines might make you worse. Maybe getting in a pool and swimming or walking in the pool and doing some gentle exercise at home is what you need. And from there on up, whether it's physical therapy, pain management, shots, or surgery, we're capable of doing that entire spectrum. So we're not an office where you walk through the door, you're gonna have surgery no matter what. So our office is like that, unfortunately. And we're not an office where you come in and, if you need anything more than just basic care, like a general practitioner treating a spine problem, we don't do that. So, they don't do that. So we can offer you an entire spectrum of care from very simple modifications all the way up to very super complex surgery, depending on what your needs are. And again, help you select what works right for you.